Hello, so many people they don't know the difference between many blood tests to diagnose blood clotting. Here in this video I'm going to explain different types of blood clotting tests and how we make use of each to diagnose certain diseases. Let's start with the common test, which is called the D-dimer test. At first we have to know what's the meaning of the D-dimer. D-dimer molecule is the end product of degenerated fibrin in already formed blood clot in the body. Why it's called D-dimer? Because the molecule is formed by a double fragmented fibrinogen linked together by a cross-link. The D-dimer test is a simple blood test. It's made to determine the blood clot conditions like deep venous thrombosis, like disseminated intravascular coagulopathy, like pulmonary embolism, like severe cerebral stroke, like acute myocardial conditions, etc. D-dimer test, it couldn't determine the location of already formed blood in the body, but it indicates only the presence of a blood clot. And now we go to the BT, BTT, and INR tests. BT is prothrombin time. BTT is partial thromboplastin time, and INR is international ratio. These tests are to determine how long it takes for the blood to clot. These tests also, through these tests, we can diagnose some diseases like liver diseases, like people who are taking blood thinner treatments, like vitamin K deficiency, like a rare condition which is called congenital overproduction of fibrinogen. So the D-dimer test is specific for the already formed blood clot conditions. For example, you're gonna find a patient who is using a blood thinner treatment. If you test him for the D-dimer and for BT, BTT, and INR, you are going to find his D-dimer is within the normal range, but BT, BTT are prolonged due to the treatment of blood thinner. So the D-dimer has nothing to do with the oral treatment. We cannot rely totally on the D-dimer test to diagnose serious conditions. Why? For example, the percentage of false positive D-dimer test is 60%. You are going to find them in people who don't have any blood clot conditions, like people who are under stress or old age or overweight or with pregnancy or with infection or with inflammation, or people who have autoimmune diseases like Hashimoto, like systemic lupus, like rheumatoid arthritis, due to associated condition which is called antiphospholipid syndrome. Again, you're gonna find a percentage of false negative D-dimer test up to 92%. This is very common if you have a patient admitted to the hospital with the diagnosis of deep venous thrombosis or with pulmonary embolism or with acute myocardial infarction, etc., of these clotting conditions, you are going to find in the first 4 days of the disease, if you test your patient, you're gonna find the D-dimer test is within the normal range, although the patient is in clot condition. But after the 4th day of the start of the disease, you're gonna find the D-dimer is increasing after the 4th day. So we cannot rely totally on the D-dimer to diagnose serious conditions. Once we find that the D-dimer test is high, so further blood tests should be done, and maybe the treating doctor asking for radiology or image studies. The D-dimer is affected in a serious condition like acute myocardial infarction patient who is treated by streptokinase enzyme injections. And this time you're gonna find from the first day that the D-dimer is starting to raise due to the streptokinase dissolves the already formed blood clots.